Greetings! It's Dr. Paul Martin with Brilliant Life Chiropractic, and it's time for Pregnancy and Chiropractic Part 2. I know I made a post about a month ago about pregnancy and chiropractic, and I thought I would talk a little bit more about the causes of dystocia, which is basically failure to progress in labor, because it's a very common diagnosis, and I said that in the last video that I did. Very common diagnosis, typically created by medical intervention, unfortunately. So that's just one of those things. So I'm going to talk about the three different causes of dystocia and how chiropractic can help with those. So you have three different things according to the Obstetrics Bible, which is basically what all obstetrics tends to follow. You've got power, and you got power, passage, and passenger. Power refers to the strength of the uterus to provide contraction, and that contraction and the dilation of the cervix is what allows the baby to be born, to pass through. And that uterus needs to contract in a very coordinated fashion to let that happen. Now, it has nerve system connections that come from the pelvis and the lumbar spine, and those nerves need to be free to communicate with the uterus so that it can happen in a coordinated way. And chiropractic works with the nerves by adjusting the pelvis and the lower back. We allow those nerves to be as clear as they possibly can. And so the uterus can contract in a coordinated way, the mother can help, and all of it can work much, much better. Labor becomes much more efficient and faster. The next thing that we talk about is called passage. Now, passage specifically refers to the passage the baby has to run through. So you have the pelvis, and then the muscles that sort of support and go through that area as well. And the techniques that chiropractors use work with the pelvis to align the pelvis. If there's distortion in the pelvis, if it's twisted, then that constricts through and makes it harder for the baby to be born. But then when you get adjusted, or when a pregnant woman gets adjusted, it allows that to open up, which gives more space for the baby to be born, then allowing for pregnancy to be easier and for birth, for labor and delivery to be easier and more efficient as well. So getting adjusted helps with two of the three causes of dystocia, both power and passage. So what's the third? The third one is passenger. Passenger refers to the baby itself, the passenger. And so how can chiropractic work with the baby? Well, we don't adjust the baby. We don't actually work with the baby at all. That is the practice of obstetrics. It is not the practice of chiropractic. However, when adjusting the mom and allowing those nerves to function as freely as possible and allowing the uterus to achieve its normal tone, that just helps the baby to sit in a more comfortable way and to assume a more proper position. It also works with the pelvis and does the same thing. When that distortion is eased, the uterus is eased, and then so do the muscles that surround the baby. And so if the baby is ever in a transverse position or in a breech position, where the head is up and the feet are down, that often happens because of constriction in the uterus. That doesn't allow the baby to get into the position that it wants to get in. And so when the mother gets adjusted, the uterus gets into its optimal shape, and that just allows the baby to be born in the proper way with the head down, which is what we want. So when the mother's adjusted, the pelvis is aligned, power, passage, and passenger all work better, and that takes care of the three leading causes of dystocia, the three causes of dystocia, according to obstetrics. So if you know someone who's pregnant, and especially if they want to have a natural delivery or at least want to give it a shot, then it's important to get them to a chiropractor. Let them see a chiropractor, because it'll help in every aspect of that care. So if you need to find someone for that, check out my description in the link below for the ICPA website to find a chiropractor who is trained in the Webster technique, who can deliver this kind of care. I am, my wife is, and there are a number of us out there. So anyway, helping you to live your life brilliantly. You deserve a brilliant life. Let it shine.